Okay, so at this point, thank you, Susan. Lots of, it really resonates with me. We did a study when I was working at the Bon Secours Health System where we counted the clicks for just the nursing admission assessment. And if you filled out every single click in the nursing admission assessment, it was 597 clicks. Now, granted, not everything needed to be filled out for a particular patient, but it was a lot of clicking, and we need to do something about that. So at this point, we're going to transition into our kind of a short discussion. And I believe, Craig, we have a polling question to kind of kick this off. Can you bring that up? All
It's
right.
up now.
Excellent, thank you. So we all know usability is really key to all of this. So we wanted to get your opinion on this question. So EHR usability is blank. To address as we identify ways to improve how we document. So critically important, important, somewhat important, or not important. So if you all can go ahead and select one of those radio buttons. Very good. Well, honestly, I don't know if anyone is surprised about this. Chris, are you surprised?
Not one bit, Patty, not one bit.
Yeah.
I mean, let's face it, the tools that we have determine how happy we are with how we can conduct the work. If we don't have a hammer, having to take off your shoes and try to beat in the nail, it's just not very satisfying.
Well, that's an interesting analogy. Thank you for that. So Judy, I know that you have been looking at questions that have come through in the chat, or any kind of themes that we want to bring up and ask our panelists after this session?
Sure, absolutely. First of all, we had a bit of a trip down memory lane where numerous folks were weighing in on comparison of the computer to paper, and how interestingly the feel of the computer is so much different. And even though we spent a lot of time in documentation on paper and the accessibility of it was so limited, it felt better. And the computer just does not feel good. So there was a lot of people, weighing in on just that concept. So that brings up again how important usability actually is. And so some of the questions that came up about usability had to do with things like, could we make our electronic health record more context sensitive, or use filtering based on the person I am, or the role that I play, maybe changing the screen? Or could we take our EHRs and adjust color and adjust font size and those kinds of things? And most of that is limited today. So maybe some comments from our panelists on just those simple concepts of changing the look and feel of what we're able to see on the screen and how that impacts usability for an individual.
Thanks, Judy. I'm betting that Zach is probably trying to get off mute right away on this one.
You got me. Yeah, I think that we have to be a little careful. There certainly are some sort of things, customization, like the example I gave where you could customize the layout so that actually you could improve the usability by having two columns together, or you can change the sort order of like which elements are most pertinent to your practice, and you can change the sort order a little bit. But we do want to be careful about changing the some of the contrast and color type elements, because you could end up making it less usable when you leave some of those components up to the individuals that maybe make suboptimal choices. And I worked in one institution where you could actually change the colors, and people would change them based on whichever NFL team was playing that day. From Baltimore, so the Ravens are purple and black, and sometimes they would put black text on a dark purple background, and you couldn't read anything, but people were so excited by being able to change the colors around. So within certain limitations, or if you put it on a red background, all of a sudden you might lose some of your alerts. So I think there is a role for customization and allowing the end users to tweak some elements of the design interface to make it more usable and useful, but there are certain limitations that need to be taken into account.
Yeah, great points. Thank you. Kim or Susan, any additional comments?
Yeah, I think there's definitely a role for customization. but also while noting that there are important reasons for some degree of standardization. I think Zach's covered some of them, but also that there are workflow reasons for standardization, both as you're teaching new people how to use the system and as you're kind of having different people interacting with the system and trying to work together. So I think there's definitely better ways that we can tailor the EHR, but it's not quite as simple as tweaking colors necessarily.
We've had a number of our nursing informatics graduate students tackle workflow redesign and redesign of user interface, particularly when there's been an untoward event or they know they've got dissatisfied nurses, and they use fundamental principles of quality improvement, workflow mapping, which we talked about earlier, so the as is and to be, but also stakeholder involvement in how is this not working for you, failure mode effect analysis to really look at where the failure modes are, and then subsequently measuring success with things like, I really love the turf model that came out of some of our high-tech money out of our UT School of Biomedical Informatics in Houston, where a lot of our graduate students have actually loaded that software to look at where are the clinicians spending most time on the screen with color heat maps and that kind of thing. So I think some of this we own, that we can use quality improvement to actually optimize the EHRs that we have when you think smart and apply quality improvement principles to what we do.
Okay, looks like we'll have time for just one last question. And this one, it's centered mostly around a workflow and its relationship to the device in the room and the person in the room. So Kim certainly, I think, did a great job of talking about workflow. And there was some discussion about this idea that I don't do real time because when I'm in the room, I have to turn my back to the patient in order to enter information. So maybe some comments about how devices can impact and what might be some good devices that would impact the usability and the ability to chart within the workflow in a real-time fashion versus after the fact in pajama time.
Yeah, I think Patty, you might have been about to say this, but I was going to say that I think in the second panel, there's going to be quite a few points of discussion on that. I know I'm looking forward to Dr. Kumar Crystal's points about the text recognition piece, because I think there's like a great potential for some novel approaches to information input, but also maybe finding ways just to eliminate some of these requirements for documentation through some really kind of innovative approaches. Video recording, can we do that? Would that be just to automate that process completely? Like, are there different things that we can use versus somebody sitting at a computer typing? But I also think that in terms of having somebody doing documentation in the room, that there are ways that we can optimize the layout of space to improve the comfort level of everyone with using the computer while the patient's sitting there or at the bedside. Of course, there are things like infection protocols that we can't get past, but just space optimization is something that I think across studies is something that has come up multiple times for us, for sure.
So Kim, just to jump on your point, so you don't feel right now anyway, there's any good enough mobile device that with our existing EHRs, I can do the clicks fast enough or move through the screens quick enough or whatever that would be. Instead of going way out there to voice, is there any way to optimize our existing challenges, let's just say, with data entry?
I think there are ways that we can improve with like mobile devices and those kinds of tools without going farther. But I also think we need to push the boundaries because there's only so much that we're going to get by optimizing space, by optimizing device entry. Like it's time to start thinking about sort of the next level of where can we go next to really make that leap.
So Kim, you're hoping that our next generation thinks about the keyboard the way we do of like the dial-up telephone,
Yeah.
right? Like
do
a
that,
thing in
yeah.
the town. Yeah.
Right.
So Judy, do we have time for any more discussion? I know.
I think we've kind of used up our 10 minutes. Yeah.
Okay, all right, because Chris sent me a little note saying he had a question for the panelists, but Chris, you'll have to hold it for later.